So this workbook, 54 pages, you'll get a 90-minute sequence out of it. The table tie workbook, 142 pages, you can easily get a 2-hour sequence out of that. Totally different, by the way. The next workbook, phase 1, 220 pages. The next workbook, 262 pages, side lying. Just side lying. I basically go, okay, start at their feet, work your way up. Now, after that 262 pages, you can turn them over and do the same thing on the other side. Yeah. So I don't cover side lying in this mat class. Unless we have like a little bit extra time, which we may, by the way. We will cover heavily on the table side lying. Heavily. There's a very distinct difference, and that's why I'm glad you guys are going through 5 days. There's a very distinct difference between this class and the table class. I decided to go ahead and do this first to kind of put you in a different environment. And then we're going to bring you back to what you know, and I'm going to go, okay, let's explode this table. Like, we're going to have you climbing over the thing like in a way that you're probably not used to using. You're going to use your body in a different way, and I think it's more transformative to like see both. Because you see some mat-based, options, but then you see like, wow, it even transforms like the way I work on a table. Does that make sense? Yeah. Now, how many of you, primarily all of you work on a table, how many of you use side lying with any regularity? And that prenatal is what I hear, and then it's like 2 people raise their hand. When I worked with students, I was really in shock that they didn't use side lying, but you forget what you know. And then most of what I've been teaching in table tie has been very heavily like side lying based. I taught a class yesterday in Dallas. The first half of the class probably is side lying. I've literally had students in the class go, is the whole thing going to be side lying? But here's the thing, if you only work in prone and supine, there's an entire primary position on the table you don't use that it's really effective, especially for like upper back and neck pain. Huge. People have upper neck and back stuff, always sideline, always. Like I do that before I put them prone. In fact, the class I taught yesterday, I had to think about it. I don't think we went prone once, 6 hours. Oh. So, somebody comes in, they come into the spa I worked at, or the chiropractor's office in my case. The client came in, they said, I have low back pain. I'd say, where? They'd say, I feel this like band like basically across what would be their sacrum. And I'd say, take off your shoes, lay down on the table just like you are. Face out on your back. And they go, yo hippie. My back hurts. What do you have me lay on my back? And I'd say, sir, I have 12 years experience in chronic pain management. Take off your shoes and lay down on your back and give me 5 minutes. And after 5 minutes, that client became a table tie client. And I never said Thai massage once because they don't know what it is. They don't know to ask for it. They don't know why I'm having their clothes on. Once I tap in to that spot and they go, oh my God, this is awesome. Then after the session, I go, that was Thai massage. And they're like rebooking the same thing. Make sense? Sometimes it's backwards. Sometimes if people have upper back pain, I'll have them lay down on their front. If they have lower back pain, I'll have them lay down on their back. There's some variability there. But typically people are sometimes confused. Thai massage can be backwards to how people typically think.